most sports do not increase the risk of knee osteoarthritis, based on data from a meta-analysis of 16 studies.
Osteoarthritis is one of the leading causes of physical disability in the United States, and some have suggested that sports participation might be a risk factor for osteoarthritis. But it's unclear whether or not the risk was the specific sport or whether it was sports-associated injuries or other unknown risk factors. So therefore, we conducted the systematic review to determine whether specific sport participation was a risk factor for knee osteoarthritis, as well as to assess the influence of knee joint injuries on developing osteoarthritis among sports participants.
What were some of your key findings?
We found that overall, when we looked at athletes combined, that there was no increased risk for knee osteoarthritis among individuals with a history of sports participation. But when we focused on the individual sports, what we found was elite level and non-elite level soccer, as well as elite level long distance running, elite level wrestling, and elite level weightlifting were associated with an increased risk of knee osteoarthritis, while none of the other sports were associated with that increased risk. I think it's important to note that those key 4 sports were also are commonly associated with increased risk of knee injury, as well as high impact loading on the joint.
What's the take-home message for doctors and patients?
I think for individuals that are interested in pursuing the health benefits of physical activity, sports participation can be a healthy way of getting those benefits. But for the individuals that are concerned about developing knee osteoarthritis, they may want to select sports that are lower in loading, have lower risk of knee joint injury, and are non-contact. Among the athletes that participated in elite level sports or sports that were associated with an increased risk, they may want to pursue methods of ameliorating their other risk factors for knee osteoarthritis, such as maintaining a healthy lifestyle, a healthy body weight, and properly rehabilitating after an injury.
For Global Medical News Network, I'm Heidi Spleeth.